Welcome to our next Alula discussion. Today I have Ilze with me. She's the product owner at Alula Technologies, who focuses on health solutions.
Great. Thank you, Nelson. It's lovely to be here.
Great, thanks. We've got an interesting conversation today. We recently hit a major milestone, 5 million health scores, which is generated through our HealthCloud platform.
Absolutely.
And we're going to dig into a bit of the discussion. Ilse is going to give us some insight into sort of how it started and where it's gone and also what's coming.
Awesome.
I know that there have been obviously interesting developments in the healthcare and the insurance industries, but also entering into the employer space.
Correct.
Ilse, thank you for joining us.
Thank you.
Great. I think let's start off looking at the milestone and the significance of this milestone.
Yes.
Can you tell us about the journey to achieve the 5 million health scores and what this milestone actually means for Alula and for our clients?
Okay, awesome. Thank you. So the exciting thing for us really is that we hit our first 1 million, I think April 2022. Okay. And since then, every million that we've hit took about 6 months. To get to where we needed to get to. But the last 5 million we hit at record time, exactly 3 months since we hit our 4 million. So that to us just shows how the health score is being adopted across the different industries. Yes, we started off in life, basically life insurance with the HealthCloud, as you mentioned, so a customer-facing solution. But we've broadened that into health industry as well, where it's consumer facing. So now you can imagine this holistic score, a dynamic holistic score, that is available to our insurers, so your underwriters, or even with people in claims, that really gives you that holistic, quick glance of a view of a person's health score at that time, with the information that is available, completely dynamic and adaptable, to make quick and fast decisioning. And now also was made available to your consumers on a health app. So now not only empowering the life insurance industry, but also empowering the health and people that look at your score, the benchmark, the competitiveness of it, the motivational aspect of that. Because if you know what your health score is with your own data, you know what you need to do next to improve your score, but also compare for your age and gender group. So that aside, now moving into other industries, very, very exciting. So, but I'm not going to jump the gun there because I know you've got some questions lined up for me.
I mean, it's interesting for me to hear. I think there's a massive emphasis on that empowerment, right?
Yes,
and it's through
absolutely.
data.
Yes.
So one is the empowerment of the insurers, empowerment of healthcare organizations, providers, and the consumer, the end consumer, which also brings about that level of transparency that the end consumer, that the clients, that the patients are looking for, and it's all based on data, and I mean that is just a fascinating space.
Nelson, so you hit the nail on the head there. So everybody's always been saying data. Data's gold, and it's something that I've been saying for many years, as a previous product owner for electronic health record as well. So data means squat if you're not doing anything with it. So what we've managed to do quite wonderfully and carefully and smartly, not just thumb sucking, but actually working with actuaries, universities. We did research. We worked with clinicians to develop this really well-rounded algorithm and arithmetic score to empower and then use that data that comes in dynamically. So let me just elaborate a little bit on that, specifically talking to the health component of it. So I think it's over 30 data points that we currently including into the health score. We've got a long list. I think it's almost 60 data points that we can include, right? But we've opted for those 30, just over, I think 31 or 32 data points that we include in the score. So those data points start at minimum with your age and gender. So that anybody that registers to use the platform, and whether that being through a life insurer or it being through an app where a person's got a connected device, so it depends on the business case, right? That data points then are included with a careful algorithm and calculation. But it's more than that. It's not just, okay, there's the data points, let's put it in the health score. There's really a thought process behind every single metric in there. Just to give you just a really great example, smoking status, right? So as you know or don't know, so we've got multiple data sources, right? So pharmacies, wellness clinics, medical aids, and so forth, and even the activity devices, as I mentioned, your fitness devices, all those things. So if you go to a clinic and you do a wellness questionnaire and you are a smoker, right? That's self-declared. At this stage, we are working on partnerships to get more pathology data, and that even makes it, more exciting for us. But smoking status, do you know how long the negative effects remain in your body and all your organs? Take a wild guess. 10 years. 10 years. So things like that we do consider in the health score. Your BMI, yes, there's anomalies, right? So your bodybuilders do have less fat and more muscle. So it's a bit of a tricky one. But worldwide, the BMI is a standard tool, right, to just identify or look at your risk, right, from a health perspective, because it's a whole lot of risk disease. So a BMI of 2 years ago won't make sense to include in the health score. So things like that. So I'm not going to give away anything about the health score, but I'm trying to say is that we've really worked with all these different experts in the field. We are refining it continuously to make sure that the data elements that we bring in make sense to both the life insurer, the health insurer, the consumer itself, right? So we've been watching our health scores wonderfully, and it has been making a major difference. And then now also the employer groups. Yes.
Well, that is exciting. I think for me, something that sort of stands out again is sort of, looking at how it is enriched through accessing more data. So we have historical data, which you've mentioned, coming through from insurers, healthcare, I guess, and sort of getting to
Claims.
the more real time, so your wearables and even more data sources sort of being, in the digital age, we know more people are connected, more people are engaging. So there's just more opportunity to access data. And I think people in general want to be more informed about their current status, whether it be health or whether it be finances, or wealth, or whatever the case. And it's fascinating because for me, when I hear you, that's very much the journey is accessing more. I think something that comes to mind from your guys' side and sort of in the developments is that looking for every digital heartbeat.
Yes, and, I love that.
And it's something that sort of stands and I hear comes through strongly from you.
Yeah, it needs to be a comprehensive overview of an individual, right? So a score on its own doesn't mean anything, but if you intelligently display that and show that and make that available to whoever can use it to empower, to motivate, right? That is the key purpose here. So one thing that you noted now that is also very key, and as I mentioned before, all the data sources, the clinic and those things, the historical data, the 10 years of smoking status as an example, ex-smoker, or your claims, your chronic conditions. Are you managing that? Are you using your medication? Are you stepping? Are you sleeping well? So that's more moving to real time. But now adding the AI, the digital health check, that we've also implemented recently, and it's making a major difference. That is a real time health check. Just a few seconds of your face scan, and it's actually exciting but quite scary to know that type of information, that technology is available worldwide. So bringing that in real time, you don't have to go to the clinic and sit in a queue or wait to do your health checks, but bringing that in, your activity, your claims, and any other information. So as I mentioned, 31 data or 32 data points at this stage. We have more that we can set up, but it's a well-rounded health score that can empower so many different use cases, business cases, processes, efficiencies, but health, making people healthier, happier.
Yeah. I love that. I think, it's a true step into, what it actually means when they say prevention is better than cure.
Absolutely.
But how do you do that? Yes. Well, this is how, and one could enable insurers, healthcare organizations to assist their clients, and also the end user in the end. And I really love that, because in the end, this exists.
Yes.
People can be in a position to pick up on things before it becomes a massive issue, and that's an exciting space. I think it's just making people healthier.
Yeah, exactly. So, but let's talk through an example, if you don't mind. So, which is practical. I'm a practical person and I'm a picture person, so this might be really good. So, yes, we've got a bouquet of services on our side, products and services. But from a health score specific and knowing about your score, having access to the data is not enough. Right? It's not enough. Yes, you might have a fright to say, okay, my heart rate variability doesn't look good, but now what? Yeah. So that is a big problem. So again, we need to empower and motivate. So what we've done is we've incorporated the health check, the digital health check, which is the face scan. We make provision for fitness devices that push through data. We know you're taking medication if you're chronically registered for a disease. But what now, right? So part of this health score, what we've developed is for every single metric that is included in the health score, we've developed different ranges. Okay. So also again working with clinicians, we did research ourselves as well, so we've got the references for it. Heart rate variability is a good example for me because I didn't know what that is, right? So in our reporting, as well as specifically to the consumer side, is we explain what that metrics means, but in layman's terms, so that me and you, the normal people out there, can understand what it means. Okay, so we've got different ranges set up. So when that range, and we also highlight what that range is, right? Because that's important to know. Okay, so it's red, it doesn't look good. Oh, am I going to get a heart attack? What's wrong, right? But now we explain very high level in a nice way what it means, right? Yes. But now we've also developed nudges to say, okay, you know what, glucose, your glucose is a bit higher than usual. Try and replace this with this. Or your steps, well done, you've improved your steps, try and keep it up by doing this and this and this, really just interactive, nice nudging that can help you to keep you motivated, to just take that little extra. We all have high days, we've got low days, right? So that is really just nudging as the metric moves between the levels to say, okay, here's a nudge, try and do this, or congratulations, or well done, as an example. But we took it a step further. Okay. So, as you know, may or may not know, is we also have our own article team, right? So we write content. Okay. So now we are linking articles to the nudge. So we explain what the metric is. So you've got your health score. Yes. You know what your health score is. It looks good. And you've got the benchmark for your age and gender. Okay, 60 is not good. Wow, the rest of our team, okay, they're 20 years younger than me. So, okay, maybe it's that. But hey, according to your age and gender, it's actually very good. So well done. So now I'm at peace. Okay, but now what is included in my health score? Yes. So then I have that. I know what every metric means. I get a nudge and I can go read up on it further. So we're trying to take that whole, so that's on the consumer side, right? But on the employer side, the insurance side, we also provide the information based on consent, right? Because consent is extremely important. We cannot share your information if you don't let us share it, okay? But now imagine the power that is in the employer's hands to know, something that we picked up within Alula, I hope I can say it, is the lack of sleep. Yes. Over the last few months in November, December. Yes. And we all know it's been a stressful period, in all industries over that time of year. So when we pick up that, and the data was anonymized. So 80% of the people not sleeping well. What can we as an employer do to support our team to make sure that they sleep better? Yes. They need time out, they need this, they need that. So it does allow for, you mentioned it before, the proactiveness, the prevention is better than cure. So it allows the employer to put the right things in place to better support the employees, and that will uplift not only employee motivation, but also productivity at the end of the day.
Yeah, I mean, I love that. There are a few things that you mentioned there that sort of again stand out, and again, I mean, that empowerment comes through, whether it be the insurers or healthcare or the employer, and it makes a lot of sense. I mean, if you have that insight, what would it tell you and what can you do with it? Which is really incredible. So picking up on sleep, on stress,
stress was also a big thing.
On action, activity, right? I mean, and I mean that for me is also is a fascinating space, because I mean with that there's so much that these organizations can do, can help, which in essence gets back to just assisting the end user, the client, which is what we all want to be.
People not just a number, they're a person, and if you look after the person, they're going to give their best.
No, very exciting. Let's shift a little bit to the to the expansion into the employer sector, which you've mentioned. And I know there's only so much you can say. It's still, very, very fresh news.
Yes.
But yeah, what can you tell us about it?
Okay. So as I mentioned, right. So we saw this opportunity, bringing in the health school into other industries as well. We saw the difference that it's making in life. We saw the difference that it's making in health. But that's not enough. So internally, I think that's probably where the whole vision started, is internally, how can we better look after our employees? Okay. And that is a huge, huge gap, we believe, everywhere. So you've got your traditional HR teams. I know here we talk about people wellness, which to me is awesome, right? There's a whole global shift towards people's well-being. So employers globally are making changes to make sure that their employees are better. So, but what tools are they using? What is available out there? So I think that's where we believe our offerings are very, very strong, because it's not self-reported I mean, we can include questionnaires. We can include the PHQ-9 for, the wellness, the depression scores, all those questionnaires. We can do that, and we do, right? But a person can lie, okay? Whereas with your vetted devices, the health check, those things don't lie, okay? So it does empower and help employers to see, okay, even if it's just to look at the whole population as a one-off. So, okay, but where are we? Do we need to get a nurse to come in every month to take bloods and make people stress more? Or what do we have to our availability to use? And that's where, as I mentioned, we believe we've hit the mark. We really need to and want to empower employers. And we're running it internally as well. We've seen the difference that it makes. Not just to the employer, empowering and helping and shaping, comms, events, all those things, but it also does help the employees, as I mentioned, the healthy competition and healthy discussions between the teams. What is your health score today? And even if you put it on a board, as an example, do competitions. If people have, because I know even in our own company, we've had a few people that had major operations, and even that tools can help the employer make sure that the recovery is happening as it should. You need to have. It's all about holistic view. It's all about that comprehensive understanding of where a person is at.
Yes.
We are, as I mentioned, focusing so much on health, but we are going to include other information and things as well. In HealthCloud itself, it's the credit score and all those things as well, because there's a huge correlation between a person's credit and health. Yes. So again, I'm not going to give away too much, but holistic view of the individual, but also on a population level, yes, to empower the employers to make a difference in their people's lives. I don't know if that answers your question.
No, it does.
It does.
It does.
Okay.
And it's a fascinating space, because some of the conversations we've been having, has really been around understanding sort of modern work, right? And modern employee demands or expectations, I suppose is a better way to put it. And the reality is that employers are under pressure to enable and empower their employees. I mean, the Ovation platform talks to the actual ability for employees to manage their employee benefits, which is something that is generally sort of, here you go, this is what you get, and you can't really work with it to to a flip to where you're empowered and enabled
yes.
to do that. Now you add this health component, which also adds then, well, take care of your health.
Yes.
Understand your status.
Yes.
Which deals with it at an employee level. Then from the employer level, it also gives that insight where they can start saying, well, maybe we need to look at sleep and have sessions talking about healthy sleeping behavior patterns, or sort of just empowering and enabling people to sort of be more conscious of what they need to think about in improving their sleep, for example. But again, it's just more sort of discussions around that empowerment, that enablement, and through digital, which is obviously a very exciting space.
Because if you are motivated to make a difference in your own life, you're going to do it. Whereas, take a child, for example, don't touch that plug. They're not going to listen to you. And we're all people. So, brilliant.
But that's great. I mean, you've given quite a bit of a insight into the health score and how it's been evolving. How it's been enriched through the ages, and also that rapid adoption that's happened, which is incredible to see. From the initial 1 million to how rapidly it's got to 5 million and now beyond. So with that being said, and looking a little bit at the future and the future direction and the innovations, what are some of the upcoming innovations and expansion plans that Alula have? What is there that you can communicate at the moment? What can we expect to come through in the space?
Okay. So I am not 100% sure what I'm allowed to say or not allowed to say. So, but what I can say is, so we started off on the health score, right? And as I mentioned before, the consent. So in South Africa specific, working on the ID number, the legal reference number. Because we do need to pull the data from the different data sources with consent and make that available, right? But whereas with your activity platform and even with the health score, it does make it a little bit easier for us then to not just be bound to a country as an example, or a specific ID number. So we are expanding beyond just that. So we are working on empowering people, not necessarily, and that's the adaptability about the health score. It doesn't have to link to an ID number. Okay, and it can be anonymous, right? So remember, we want to empower the individual. So that, again, depending on the use case, if it's the employer, the consumer, whatever the case may be. But we are expanding into territories beyond South Africa. We have been expanding in other territories, UK, Dubai, working with so many different other entities and industries that we are looking at. Also going into retail, we're a Microsoft partner, working very, very closely with them. Some really exciting stuff that's coming with a tool that everybody is using. I'm not going to say, but that is exciting because we are looking at making that health score available with a digital health check, with the ability, if the employer or depending on the use case, depending on the solution, with adaptability, different data sets can be included in the health score. It still means something, right? So it doesn't need all the 31 data points. It doesn't, and it can be expanded. But yeah, so we are moving into other territories, other industries. Doesn't necessarily have to tie to an individual, but yeah, so we are seriously steaming ahead and making the health score available. Yeah,
taking it into the global markets.
Yes,
right? Exciting.
Yes, very exciting. We believe in what we do, right? And we believe what we're doing is making a difference, and that is the thing. Yeah. That is the thing.
No, thank you very much. Okay. I think that's really what we have time for today.
Okay, awesome.
To close off, I'd just like to say congrats to you and the Health Solutions team. It's an incredible milestone. 5 million. I look forward to seeing it grow or continue to grow. And I look forward to having more and more discussions with you about the new developments happening in your space.
Awesome. Thank you so much. Appreciate the time.
Thank you.
Okay.